Yeah, I believe that, and this is true, for avelumab and all other checkpoint inhibitors that we have been used to be doing in practice. Very important really is the education of patients, particularly in the evaluation and understanding of side effects. Unlike chemotherapy, where we often tell patients, look, once you're done with the chemotherapy or once we hold the chemotherapy, a lot of the side effects actually do improve and resolve. Not quite so with immunotherapy. So it's not enough for us to stop the immunotherapy. We have to institute steroids. So educating these patients is very important in recognizing the potential immunotherapy side effects. Now, there are, of course, practical application also in avoiding or maybe mitigating infusion reactions. So giving them pre-medications, and this is unique actually to avelumab. With a lot of other checkpoint inhibitors, we don't usually pre-medicate, but we usually do with avelumab, with the use of Tylenol, Benadryl, to avoid the infusion-related reactions. So I think education is a very important part of supportive care. Certainly, if they do ever develop any immune-related toxicities, then steroids or other immunosuppressive drugs are key.
So we talked to the patients about the benefits seen in the study and the commitment of every 2-week dosing. Now, a lot of patients who come to tertiary referral centers come from far away, and it may not be feasible for everybody. And even on the study, a lot of patients missed a lot of doses, due to a variety of reasons. And the study does not have an endpoint to avelumab. Patients can continue until they progress. So it is a long-term commitment, and we do present the risks and benefits to the patients and go from there. I think the key for my practice that I use is I tell them the benefits of immunotherapy as opposed to chemotherapy whenever I'm prescribing it. But then I always make it clear that even though immunotherapy is very, very well tolerated for the most part, there can be some serious side effects. We have seen a lot of these, and some we may not have seen so far. So patients need to be really on top of their symptoms and inform us even if they notice a subtle change from baseline, because we could be missing something important. So there's a lot of counseling that goes in that regard, and we provide a lot of uh, materials to the patients so they understand when to call us.